Welcome to the Weekly Chaos Podcast with Addie and Diego,
where we talk about life in the operating room.
Hey guys, welcome to the first episode of the Weekly Chaos. I'm Diego.
I'm Addie.
So this podcast is basically stemming off of Addie's TikTok, right?
Right.
Social media presence.
Yeah.
If you want to call it that. And it's basically to give our followers, I guess viewers or whatever, a more in-depth behind the scenes of what goes on behind an operating room.
Right.
Right? Sorry, that's my ring. Let me turn it off. Let's tell them what a surgical tech is. Right? What do we do?
For the surgery, we get the room ready
Yeah.
for every surgery.
Yeah.
Make sure we have everything the doctor needs, everything the patient needs.
Yeah.
And the surgery goes smoothly and doctor's happy and patient's safe.
Right. Like we assist the surgeon during the surgery. Get yelled at most of the time by angry surgeons, stuff like that.
Yeah.
So we work at a private surgery center. We're not gonna get too much into that, but let's tell them how we got into this. You wanna go first?
Yeah. I saw the program and I was like, this is perfect. In 2 years, I'm in the operating room.
Right. What intrigued you about the OR? What did you know about the OR?
I think
Well, so when we say OR, I don't know. I know we have some followers that probably don't know what that means.
the operating room.
Yeah, we refer to an operating room.
The surgery, the blood, I don't know, I've always been interested. My mom was a nurse in Cuba for many years, and she always took me to the hospital, and I saw like patients with cuts, and I was like, I want to cure them, I want to help. So I was always intrigued by surgery. So I liked it.
Right.
How did you get into it?
So I had a friend back in the day, and she went to look at some programs. I think it was a MA program at this school that provided, I guess, had a lot of technical programs or whatever you want to call it. And I remember walking in and I saw a billboard of people scrubbed and during surgery, and I was really intrigued. I wanted to see what that was, and then I sat down with a counselor that same day, and I was hooked. I loved everything about it, and I guess that stems off of. So I went to. So my parents are from Ecuador, and I went to Ecuador one summer when I was, I think, a junior or a sophomore in high school. And the family friend was a doctor there, and for some reason I wanted to go see what she was doing, and I remember she brought me into the surgery, I forget what surgery we did, and I was able to watch it from a corner, and I was so intrigued with patient care and everything, so that correlated, and I wanted to do it, and I did it. So balancing a life when we live together and work together is very tough, and at the beginning we struggled quite a bit. Very, I love it. You know, someone here is a little, what's the word I'm looking for?
I don't know where you're going with this.
Can't think. I'm having some brain fart.
I don't know where you're going with this.
You wouldn't put any, you know, you always want to be next to me. Oh, a little clingy. I don't want to say it's her. It could be me. I don't know.
Okay.
But a couple months went by, and I feel like we had a talk, and we realized how we can make this work.
Yeah.
And it's been a lot better. It's not perfect. I went to work somewhere else for a couple months. Not specifically just because of that, but it was very nice not seeing each other all day and missing each other at work. But we do our best to not see each other. We don't work in the same operating room.
It's rare that we do.
So we try to take lunches, breaks, everything apart.
Yeah.
So talk about at the beginning, right? Where we talked about your social media presence. You want to tell them a little bit about that?
Yeah. So I wanted to do YouTube.
You want to do a vlog?
I wanted to do vlogging. Yeah. But I didn't realize how hard it was going to be and how much
I told her
time you have to invest and how much recording you have to do. And we have a very hectic life, and we don't really have that much time to be recording. And if we do very repetitive stuff.
So I suggested to her, what better than doing TikTok?
Short.
20, 30.
Yeah.
You can make it a minute. Now you can make a 3-minute video, and it's great. We started making videos at work. One video went quote unquote viral, but not really. It had like 2 million views. And then it hit. And she
Yeah.
loved doing it. She does videos. She does everything. So if you guys want to take a look at those videos and see what we're talking about,
Yeah.
our handle is at
The weekly_chaos.
right on Instagram. It's the Weekly Chaos, and on YouTube it's Weekly Chaos. So just look for a picture that we have a picture of both of us wearing a mask.
Yeah.
You'll see it. Yeah, it's just something to note that all our videos, I think majority of them, I think there's just one that don't includes a patient. Most of them do not include patients.
I think two. I had a previous one and one coming up that has a patient, but patient signed consent for it. So
Yeah, so the
Okay.
patient is aware, and it's not our consent. It's a generalized consent for usage of I forget
Yeah.
what it is. One of the doctors have it.
but
and-
you still can't see their face or anything.
Right, but we still can't use an
But-
extremity.
Right.
And then usually when we do videos, we have our model Ernest,
Yeah.
and he'll be someone that will come on to the podcast, and he's doing great things as well. I would love for him to come on and speak, and we're always
He's
on his
teaching,
TikTok
yeah.
live, and vice versa. So yeah, keep an eye out for that. Comment questions you guys want us or topics you want us to cover on this podcast,
Or videos you want us to make.
or videos you guys want us to make.
Yeah.
Maybe you have you broke your ankle, you have surgery coming up. We can probably show you how you're going to be positioned, how you're going to be
Mhm.
draped. We can open trays in the back and show you what kind of
Instruments.
drill instruments. Our drills look exactly
They're
like regular.
intimidating.
They look exactly like regular drills that we use outside, but it's a little different, obviously,
Yeah.
because they get sterilized and everything. Us on Instagram,
Yeah.
TikTok, YouTube.
Ask Theo to be more on TikTok so he can
Yeah,
record more
I'm a little
videos.
shy. Plus, it's just, how do I say this? I do a lot of the bigger cases,
You do.
so I'm a little bit more focused, and I kind of don't want to take time away from me getting my room ready. But I definitely take a more in-depth in spine. I feel
You're
like
trying to say that I take time away from my room to make a video.
no, it's just you do smaller cases, so it's less you have more time on your hands.
That's
That's
nice
not,
to
that
say.
came out wrong, but you know what I mean.
No, I don't know what you mean.
But yeah, so follow us on all our handles. We gave them to you previously, and so look out for future episodes.
See you on the next one.